What's up, y'all?
Welcome back to our channel. I'm Patience.
And I'm Loic.
And we are
a couple of MPs.
Ooh, we getting better at that. Hi, so if you're new to our channel, welcome. If you're returning back, thank you for sticking with us. We hope that you guys continue to learn with us, grow with us as we take you on our nursing journey.
Thank you so much for all of you guys that left comments, that liked the last video, that subscribed. We see y'all. We appreciate it.
All right, so for those of you guys who are new, I am a nurse practitioner. I am a women's health nurse practitioner.
And I am an adult and gerontology primary care nurse practitioner.
Yeah, so I guess I should have said that we're both nurse practitioners. Anyway, so today's episode, we're going to talk to you guys about the different subcategories of nursing.
Yeah.
So there are many different kinds of nursing, not only just the specialty themselves, but different types of nurses, right? So we're going to talk to you guys about CNAs, LPNs, RNs, and nurse practitioners.
Yeah. Typically when people say nurse, they mean a lot of different things, and we're really going to break that down today. Right. Now, our objective is to present all these professions in a way that allows you guys to be able to see their duties, the education requirements, and be able to make an educated decision about what profession best fits your passions and your lifestyle and so forth. We are not here to say that one profession is better than the other, because at the end of the day, we're all nurses, and that means that we treat our patients with dignity. And so whether you're a CNA, a LPN, a RN, or a nurse practitioner, we all carry that nursing profession. That's our nursing identity.
Absolutely. Okay, so without any further ado, you want to talk about it, babe?
Yeah, so we will start with CNAs. Okay. CNA stands for Certified Nursing Assistant. And typically, CNA school can last anywhere from 3 to 8 weeks. And after folks finish their CNA programs, they have to sit down and pass their CNA exams. Now, when you get your license, you can practice as a CNA. CNA, there is a misconception that CNAs only work in nursing homes. What you got there?
Who told you? Okay.
You taught me. However, in reality, CNAs can work in nursing homes, long-term care facilities, hospitals, physician offices, or provider offices.
Okay.
And they can work in a lot of different environments. And typically, their duties revolve around activities of daily living. You might hear folks say ADLs. So they help patients with showering, dressing, feeding, and so on. They are also able to assess these patients by checking their vital signs. So they are capable of checking blood pressures, pulse, oxygen, and so forth.
Right. That's good.
Thank you.
Summing it up. All right. So the next subcategory of nursing that I'm going to be talking to you guys about are LPNs. LPN stands for Licensed Practical Nurses. In some states, you might know them as LVN. Ooh, you thirsty?
Drink your water, people.
As LVNs, licensed vocational nurses. These nurses typically go to school anywhere between 12 to 18 months. It does depend on the state and the program itself. Once they're done with school, they usually sit for their boards. Well, not usually. They have to sit for their boards. They take the NCLEX PN. Now, I say PN because it is different from the NCLEX RN, which Loic is going to talk to you guys about later. And once they pass their boards, they're now able to work in various different settings, similar to what Loic said about CNAs. They can work in hospital settings. They can work in long-term care facilities. They can work in provider offices, etc. Their job duties, similar again to what Loic said earlier, for CNAs, so it includes activity of daily living, but they're also able to give medications, they're able to give injections, they're able to start IVs. In some states, they're able to do infusions. Now, that does depend on the state and their scope of practice within that state.
Catheters too, they can insert catheters.
Yes, catheters as well.
I was trying to make a gesture underneath the table.
That was not subtle at all. I heard this big thumb. I'm like, why is he kicking me like that? Okay, go ahead.
So, moving on to registered nurses. Registered nurses, in order to become a registered nurse or RN, you can either get your ADN, which is your associate degree as a nurse, or your BSN, which is your bachelor's science as a nurse. Now, your ADN can take you anywhere from 18 months to 2 years, and your BSN can take you sometimes 3 years, but most of the time 4 years, like any other bachelor's program. Now, after these students finish their education, they have to sit down and pass their boards. This is what they call the NCLEX RN. Most people just think NCLEX, but NCLEX RN specifically for the RNs. When they pass their NCLEX, they get their license and they can finally practice as registered nurses. Now, the duty of a registered nurse is to collaborate with the provider, whether that be the nurse practitioner, the physician assistant, or the physician, in order to take care of these patients. And so they will execute the orders that were placed by the provider. Oftentimes they have a lot of time with the patients, so they will often be educating the patients about their diagnosis, the treatment course.
Right.
They will be educating the patient's family about the situation.
The plan of care.
Registered nurses also create their own nursing care plans. So they execute these plans that they create on their own. And they're well versed on the medications. So these medications that are being ordered, they administer them, but they're able to monitor whether or not these medications are working correctly, whether the patient is progressing effectively, and if something is not going right, they're able to pick up on that.
Right.
And if that happens, they report it back to the provider, and the plan gets adjusted, and they go back and execute those orders. In addition to that, registered nurses, they practice in a lot of different settings. You can have registered nurses, like for example, myself, when I was a registered nurse, I worked in psych, and Patience, when she was a registered nurse, she worked
labor and delivery.
Exactly. But you can have registered nurses working in the emergency room, in the ICU, in the oncology office, in urology offices. It's a lot of different settings that they can work in. And in addition to that, registered nurses can also work as travel nurses, just like LPNs can work as travel nurses as well. And so you have that flexibility. For example, if I was a registered nurse and I wanted to go to California and take a position in psych for a few months, I could do that. And then when that's done, I might say I want to go to Miami, Florida and do psych again for another few months, and I might do that. And then a few years down the line, I might say, hey, I want to do labor and delivery, and I can do that as well. So there's a lot of flexibility in that way.
There's a lot of flexibility across the board, I think.
Absolutely.
We should say.
Yeah.
So the next subcategory of nursing that I'm going to talk to you guys about are nurse practitioners. To become a nurse practitioner, you do have to have your BSN RN. I know Loic spoke earlier about the two different routes that you can take to become an RN, which is the ADN path or the BSN path. But in order to apply for your graduate program, you do have to have your BSN RN, okay? So once you pass your boards, you now have to decide what specialty you want to go into. I chose women's health. He chose adult gerontology. Some people choose family. Some people choose psychiatric. Some people choose pediatrics, etc. Some people can even choose administration, which is another option. So once you decide your specialty, you then decide which route you want to go. Some people choose to do, part-time versus full-time. Full-time, you're usually in school for about 2 years. Part-time, you're usually in school for about 3 years. Now, some people may choose the part-time route because of family situations. They may choose it because they want to work and pay for their schooling as well. Once you're done with school, you sit for your boards. Once you pass your boards, you're now able to work as a nurse practitioner. You can work in various different settings, similar as what we spoke with CNAs, LPNs, and RNs. You can work inpatient or you can work outpatient, and you can choose. You can subspecialize. Sorry, guys. Sometimes my Liberian English wants to come out. Yeah, nah. Why are you laughing like that?
I think you were going to talk about residency programs.
And you can also do residency programs after you graduate to prepare yourself for the specialty fields that you would like to go in. For example, some women's health nurse practitioner may choose to do urology, and so sometimes there are residency programs for urology that women's health nurse practitioners can do to work in urology offices.
Or they may even want to do women's health oncology, GYN oncology, and do a residency program.
Right. So there's a lot of different subspecialties within the specialty which you have chosen. So now I lost my train of thought because I'm listening to you.
We're going to talk about the overall duties.
So nurse practitioner job duties include assessment, evaluation, diagnosis, co-management with other nurse practitioners, physician assistants, and physicians. We do work in a collaborative agreement with a supervising physician in many states. In some states, nurse practitioners are actually able to practice independently. Massachusetts is one of them. Yes. There was a lot of crickets right there. Massachusetts is one of them. And yeah.
Yeah, I mean, nurse practitioners absolutely are responsible for the whole care of their patients.
Right.
And so they're the ones making the decisions when they order the EKG and interpret it, or when they order the labs, whether they're interpreting the labs. Sometimes they order imaging studies and interpret that themselves. Sometimes
or radiologists may interpret it, or ultrasound tech may interpret them.
But regardless, they're ultimately the ones making the decision as to what to do for this particular patient.
Right.
There's a lot more we can talk about as far as nurse practitioners, RNs, LPNs, and CNAs.
Right.
But we will get into more details in some of these topics as we go over time.
Right.
One topic that I'm always being asked about is like, what's the difference between a nurse practitioner and a PA?
Right.
Or the difference between a nurse practitioner and a doctor?
Right.
And these are things that we'll talk about over time.
Right.
As we make more videos, if you have comments on topics that you'd like for us to touch on, please comment. Please continue to like and subscribe the videos. And tune in for our next video. We will be talking about money.
Money. Ow, ow. I'm too excited about that. Bye, guys.
Toodles.